That goes back a very long time. I come from a small family, but we have no doctors in the family. At about the age of 8, I developed an interest in pursuing a career in medicine, but no one knows why. Ever since I was a child, I could only remember wanting to be a doctor, so I pursued that desire. That's it. That started also quite young, since I always wanted to be a doctor, and I started that dream at about the age of 8 years old. When I was in 7th grade, I recall my English teacher, Mrs. Myers, saying in class, if we wanted to aspire to something, what was that career choice that we were looking towards? And when she came to asking me, I said I wanted to be a doctor. Mrs. Myers had said that the only place that one would go would be to the Johns Hopkins University because it's the best. So as I was going through high school, I applied to only 2 programs. One was at Johns Hopkins, one was at Brown University. And I recall the day that I received my letter from Johns Hopkins. I was nervous as heck. My parents weren't even home. They were away in Florida. And I was going to pick them up at the airport. On my way, I stopped at home. I picked up the mail, and there was the envelope from Johns Hopkins. I was so nervous about opening up the envelope, I couldn't open it. So I started to drive to the airport, and as I drove, my nerves kind of overtook me, and I was filled with emotion. So I reached and grabbed the phone and spoke with my aunt and uncle before leaving the house. And my aunt and uncle said, well, why didn't you open it? And I still didn't want to open up the envelope. I was too scared. Well, ultimately, I got to the airport, and when I got to the airport, I opened up the envelope, and I was accepted to Johns Hopkins. And that was a dream come true. And I recall walking through the terminal holding the letter. When I walked up to my mom and my dad, I couldn't even verbalize. And I handed the letter to my mom, and she's the one who told my dad, because I just couldn't get the words out. So it was a dream come true ever since I was in 7th grade. I followed that dream ever since. I am a board-certified orthopedic surgeon, and I've been practicing orthopedic surgery since the year 1993, so it's now 25 years. To be board-certified means that first, you have to meet the requirements from the American Board of Orthopedic Surgery, which means you have to complete, in good standing, a board-eligible orthopedic residency training program. I have to receive the appropriate recommendations from my peers, as well as my mentors, to be allowed to sit for my boards. Then, to pass your boards, you have to first pass a written exam and then an oral exam. I did that in the early stages of my career. Then every 10 years, I have to meet all of their requirements during the course of that 10 years, and then recertify by taking a written exam every 10 years. And last year, I actually met the requirements early, and I recertified successfully last year, so I am now board certified for the next 13 years. An orthopedic surgeon is actually a surgeon who treats all musculoskeletal injuries and or diseases. Musculoskeletal meaning anything that has to do with the connective tissue system. Muscle, tendon, bones, nerves, joints. So I treat all of those conditions. So everything from the chin all the way to the toes. So I treat fractures, I treat sprains, I treat broken bones, of course, children as well as adults. I do joint replacement surgery, hips, knees, shoulders, elbows, wrists, the list goes on. I do arthroscopic surgery as well, arthroscopic surgery of the shoulder as well as the knee. So I do reparative work in the shoulder and the knee, which does take a lot of skill and talent because it's very, very hard to be able to get that three-dimensional thinking as an adult. Children get it because they're used to computer games, but as adults, we're not so used to that. So I do a lot of arthroscopic work. I also do spine, both non-surgical, minimally invasive, as well as major spine work, including fusions, disc replacements, injections. So I cover the gamut when it comes to orthopedic surgery and the human body, from the chin all the way again to the toes. Not knowing how other doctors practice, I can only speak for myself. But it's been time and time again that patients come to me and they feel as though they get a different experience and they're treated differently in our practice. What I do in our practice is keep our practice small. We have only a handful of people, and my staff gets to know each of my patients. Each of my patients, when they come in, they have time that's set aside for the doctor, and it's usually not a short amount of time. So we spend a lot of time with each of our patients. We follow up with our patients carefully. I look at all of my patients' MRIs and X-rays myself. I don't like to read reports. Reports should reinforce what I believe is wrong. They should not tell me what's wrong. The study that we order, or the studies that the patients come in for, should reinforce what I think the patient is experiencing and their subsequent diagnosis. A great example is recently a patient came in and he had seen other doctors and had had 2 surgeries for a broken collarbone. When I met him, he described symptoms that were both related to his collarbone and also to an underlying disorder in his shoulder. So I ordered an MRI and I looked at the MRI, and in so doing I realized that he had a ligament tear in his shoulder, and at no point in his treatment had he ever been treated for that condition. And in fact, an MRI had never been ordered. Everybody focused on his broken collarbone. So I was able to diagnose that not only was he having a problem with the plate in his collarbone and therefore having pain from that, but he had instability involving his shoulder. And when I asked him further questions, he actually explained that he had had problems throwing ever since he was in high school and was on the baseball team. He recalled an injury, and ever since that time he had difficulties throwing. But no doctor had ever focused on that. So one of the things that I find is maybe unique to my practice is I still listen. I don't just order tests and read reports. I still listen to the patients. So I go beyond the study. I go beyond the report. I really like to figure out what's wrong with a patient. And if I can't figure it out, then I'm going to find somebody who can. And that's what I think is special about the way I practice. First of all, I think they would expect that we're not going to have a packed waiting room. Okay, that's, I think, important. That our staff is going to be cordial and accommodating, and will all be helpful. In addition, when the patients come in, they're going to see me, since I don't work with nurse practitioners and physician's assistants. So I am the doctor, and I'm the person who does see the patient and evaluate the patient. I expect the patients to be quite comfortable with us, and also learn that they can call us at any time, weekends, evenings, etc., and we will get back to them. So I pride ourselves on having a family-oriented practice, and I like the patients to be considered an extension of our family, and they should feel comfortable reaching out to us at any time. The one thing about orthopedic surgery is that it's a very progressive field. There is developments that are occurring almost by the day. Being involved in some of the more progressive areas of orthopedic surgery, specifically arthroscopy and spine, I've been involved with several companies in the past that we've worked together to develop certain things. Specifically, in the cervical spine, I've been part of the development of some of the titanium research that has occurred, and titanium implants are something that is very specific. Titanium is a material that the body likes. It's a bio-friendly material, whereas cobalt, chromium, stainless steel are not as bio-friendly. We discovered many, many years ago, while I was still in training, that under the microscope, specifically the electron microscope, that we realized that bone actually grew to and onto titanium, Whereas with stainless steel and cobalt chromium, there was a small, fairly microscopic gap that occurred. And I remember that research that occurred where we were at, and we helped to create, if you will, the biocompatibility area of medicine, something that is old school now, but when I was younger, certainly something that was on the cutting edge. In addition, arthroscopic rotator cuff repair, I was part of the early pioneering into arthroscopic anchors that could be delivered so that they could tie knots inside the joint and deliver implants without making large incisions, something that now is commonplace and is the gold standard. Now I'm involved with the research with cellular regeneration and stem cells. I work with a company very, very closely that has a cellular biologist, and we're developing machinery and instruments that will actually increase the sensitivity and the delivery of the stem cells and the various cellular components that help with healing and decrease inflammation and enhance early bone incorporation into healing. We have a cellular biologist that is part of that. We're running studies with the FDA. So we definitely want to be around for a long time, since it's a major future in orthopedic medicine, and in fact, probably in all of medicine. So I'm at, shall we say, the early stages of that, and plan on being a part of that for a long time to come. I'm passionate about a lot of things. We all have addictive personalities, and my addictive personality is that I like to work. I like, though, making the right diagnosis. That's my passion. I like treating patients. I want to be the guy who makes the right diagnosis, and hopefully I'm also the guy who can fix that patient. I pride myself, and our practice prides itself, on just doing the right thing. And at the end of the day, patients are happy, patients do well, and hopefully the patients find themselves getting the answers that they need. Sometimes it's with surgery, many times it's not. But the biggest part of what I do is giving the patient the right diagnosis. And I believe that that is my passion. Our primary office location is here in Boca Raton. I've been here for about 4 years. I also have a part-time practice down in the Florida Keys, which I've been in practice ever since 1993. I also have a practice up in Orlando, and travel to Orlando every other week to see patients. And in the future, we may be traveling to the West Coast, to the Naples area or Tampa, St. Pete area, to also get involved in seeing some patients on the West Coast as well.